Okay, so I have quite a bit that I'm going to talk about. I'm going to try my hardest not to stare at my notebook, but we all know chemo brain, takes the best of us, so I don't know how much I'm going to remember or what. So I'm going to start off by telling you all my story. I was diagnosed in November of 2013. My journey actually started several months before I was diagnosed. Me and my husband were going through infertility treatments, and about, I would say, my third month of my infertility treatments, they started putting me on estrogen supplements. And when they put me on those estrogen supplements, I started to notice that I was getting a pain in my armpit. And I also, previous to all this, I always had a little bit of a discharge from my nipples, but I never thought twice about it because I had gone to several doctors who have said, it's nothing. They even did blood work. Everything came back okay. So I didn't think twice about it because they all told me that it was nothing. When I started to worry was that third month that I was taking those estrogen supplements, and that discharge turned into a bloody discharge. So I went to an OBGYN up in New Braunfels where I live. It was the first time I had gone to her. I went for my annual. And I told her about my nipple discharge, and she had, pardon me, but she had squeezed the crap out of it, and it hurt so bad, and she took a sample of it, and she thought that it was a staph infection. Well, it came back nothing, and she just kind of let me go, and in that appointment, she actually told me, you're too young, there's no way that you have breast cancer. It's my doctor, so I believed her, I trusted her, I left, went on my way. And so 6 months later, actually 5 months later, me and my husband started to do IVF. And halfway through my IVF, before I started any injections, our insurance got all crazy and messed up. And so mid-October, we switched insurances. And I'm telling you this all because it's going to come into play when I get to the end. But we switched insurances, and about 2 weeks after that, I felt my lump. And I was laying in bed, and it was probably 11 o'clock at night. I don't even know why I was feeling anything, but I was just kind of pushing around, and I felt this little, it felt like a frozen pea. And my heart kind of sunk in that moment. I knew something wasn't right. I guess in that moment in a million years, I didn't think I was actually going to have breast cancer, but I called that same OBGYN the next day, and I told him I feel a lump. And they told me, wait 3 weeks, call us back, it's probably hormonal. And I wasn't accepting that this time. This time I went to, I called my old OBGYN, which is actually next door here at Oak Hills Women's Center. And it was the first time I was seeing the doctor there, because my other doctor there when I was going there years ago, she left. And immediately she sent me in for a mammogram. The next day I was getting my mammogram. And then 2 days later I was getting a biopsy, which to me was the most painful thing ever. And then within a week I went back, and I went into that appointment so confident. Me and my husband were there, and I just, I sat down in that chair, and we waited for probably 20 minutes for the doctor to come in. And I was so sure that he was going to come in there and say, you're good, no breast cancer, it's just a cyst, we need to remove it. Well, that wasn't the case. He very bluntly told me, you have breast cancer. So in that moment, I was in complete shock. I don't think that it hit me, and I came out of the doctor's office, and my husband, was trying to be as, comforting to me as he could, and I didn't want that at that point. I just wanted to be alone, and I shut the door in the car, and I called my mom, and I just started screaming on the phone. So I remember the car ride home, I was just like in disbelief. I couldn't believe that any of this was happening. And when I got home, I was standing in my kitchen, and I screamed at the top of my lungs, why is this happening to me? And before I got to my knees, my husband picked me back up, and he, said to me, which he said to me several times throughout my entire journey, I don't know why this is happening to you, but we're going to figure it out, and we're going to do everything that we can to beat this. So within 3 weeks of my diagnosis, there I was, sitting in a chair, getting chemo. This place I never thought I would be. Was bald at that point because I had decided that I was going to shave my hair myself. I actually shaved my head as soon as I found out that I was going to have chemo, because I was not willing to let chemo take my hair. It was already taking so much from me. I wasn't going to let that happen. So I had a shave party up in Austin, and I had my closest friends and family. We all went up there and made it a really fun event for me, and shaved my head, and you know, that was it. So I was a terrible chemo patient. I was awful. I hated it. I was miserable. I cried all the time. Every single appointment I went to, I cried.
Were you a biter?
Huh?
Were you a biter?
I was not a biter. I was not a biter. I was a crier, though. I spent 4 months in bed. I didn't really do anything. I didn't force myself to get up and walk, to be active. I was depressed. I was sad all the time. And I was 107 pounds at my lowest. So for me, it was looking in the mirror, seeing myself bald. I was losing my eyebrows at that time, by the time I had been down to 107 pounds. And, you know, I looked in the mirror and I looked sick. And it wasn't, I could deal with everything else, but it was so hard looking in that mirror and seeing myself like that. But at the same point, it gives you an appreciation for everything that you have now. You know, yeah, my hair's short right now, but we're the few women that can actually look at ourselves and see our face that way. And, you know, see what our hair looks like short. Not many people have, I'm sorry, but not many people have the balls to cut their hair that short. So to be able to see your face like that and to look at yourself in the mirror in a completely different way and have a new appreciation for, you know, everything, for your eyebrows, for your eyelashes, all of those things. It's just, you know, you have to find the positive in everything. And though I struggle with that a lot, you know, it's one of the things that I think keeps us going throughout our journey, is just finding the positive things, like the little tiny things in each day. But there was a point in my journey, in my, you know, when I was getting chemo, that I wanted to give up. And I couldn't do it anymore. I was so confident I just could not do it anymore. And my oncologist had said to me, you know, if you don't want to do this anymore, we can stop now. And I think I was looking for her to say, no, you have to do this. And then I was going to push back and be like, no, I'm not doing it. I don't care. But she didn't say that. And she was just like, it's okay. You don't have to do this anymore. And, you know, I had the encouragement from my friends and family, and I ended up changing my treatments from every 2 weeks to every 3 weeks. And having that extra week for me was actually really good, because it gave me a little bit more energy. I was able to start walking again. So that's when I started on the Taxol. And I was able to kind of get my energy back a little bit. I don't know how many of y'all have been on Taxol, but it does a number to your feet and your hands. Mm-hmm. So thankfully they, you know, gave me the frozen booties and the frozen gloves, so that helped a lot. So I finished my chemo, and, you know, I had my double mastectomy 4 weeks after my last chemo. I did immediate reconstruction with expanders. Dr. Ledoux here at PRMA was my doctor, and I love him to death. And then I did my final reconstructive surgery in August of 2014. So after I finished with my last surgery, I thought, I'm done. I don't have cancer anymore. I'm good. I'm going to move on with my life now, and everything's going to be great. But little did I know that the hardest part of my journey was about to begin. And I think this is a part of cancer that nobody talks about, and it's depression. You get past everything, and, you know, you're faced with, what do I do now? Everything has changed so much. You know, it's easy for everybody else to look in from the outside and say, I want you to go back to being the person that you were before, or you're, you know, going back with your daily routines the way you did before cancer. But in your head, you have a lot going on. is my cancer going to come back? What is that pain? I have a headache. Is it cancer? I have a pain in my stomach. Is it cancer? Do I need to call the doctor? What medicines do I need to take? You know, there's all these things going on inside of your head that, you know, it's just, it's a plethora of fear. Like you're just, it takes over you. And so for the longest time, I kept asking myself, why is this happening to me? Why is this happening to me? And it wasn't until I started to ask myself, what is the purpose in all of this, that I started to really change my train of thought. I wanted to know what God was trying to tell me. And I couldn't look at it from the perspective of, why is this happening to me anymore? Because it had already happened. I needed to look forward. That answer didn't come clear at all. It was a lot of self-discovery. I thought I found myself in my mid-20s. I didn't think I was going to have to discover myself again in my mid-30s. I had had my business with my photography. Me and my husband were trying to have a baby. We had just gotten married 3 years before. We were, you know, moving on with our life, trying, you know, just trying to do what everybody else does, you know, and we just bought a house and all these things, and then, you know, it just, I feel like it was just kind of taken away from me with cancer. So my depression really started to hit me in November of 2014, and there was nothing that was taking away my fears and my sadness. It was, you know, a constant battle. And I thought, you know, I'm cancer-free. I should be happy, right? You know, I should feel great. I should be so optimistic and happy with life, and I just wasn't getting there. When I was going through treatment, I had protection. You know, you have this medicine that's killing the cancer. You have radiation that's killing the cancer. You have a surgery that's taking the cancer out of your body. Well, then here you are, and you're just like, what do I do? And it's kind of like, you know, I got this to this place in my head where I started to feel like it's just a matter of time. It was an obsession to me. And that thought alone, that this was my new normal, that depression and anxiety were going to be a part of my life for the rest of my life, was enough to push me over the edge. So this is where it changed for me. I've been going to a therapist for PTSD. I was diagnosed with post-traumatic stress disorder back in October. It's not uncommon for cancer patients to be diagnosed with PTSD. So I've been going through a therapy called EMDR. And I'll tell you more about that if you want to talk about that afterwards, but it's a really great therapy. And the last session that I went to, I walked in, and that was when I was kind of in a really, really bad place. And I could barely talk. I was crying so hard. But she said something to me, and she said, sometimes life after cancer is harder than life in cancer, which to me meant so much to me. I felt like I was crazy. I felt like, I'm done with cancer, I should be happy, and I wasn't. And this was all so much harder, and I was putting so much pressure on myself to be this person and to be a happy person with this, you know, crazy purpose that I was going to help every breast cancer survivor, and I was going to come up with a cure myself, and, you know, all these things. Like, I wanted to do it all. And I think that pressure alone for myself was a little too much. But I left that appointment feeling like I wasn't alone. My therapist is actually a breast cancer survivor herself, so when I speak with her, I feel like she understands what I'm saying. But it was after that appointment that I decided to write a very detailed blog. I write a blog, which I gave you all my card for. It was after that appointment that I decided to write a very detailed blog about my depression. And I think that it was something that was really therapeutic for me to get that out and to admit that this was something that was going on. And I had so many women reach out to me. People were emailing me, texting me, commenting on my blog. And, you know, I started my blog with the intention that I was going to help other women, that I was going to help other women not feel so alone all the time. And I do that. I know I do that. But I didn't know that after writing that blog and having all of those people reply to me and reach out to me and telling me that they felt the same way, that it was going to help me. And it was huge for me. It was such a turning point for me. I want to be honest and tell you that I'm still a work in progress. it's a daily process, but it's also a choice. I think we all have to make the choice that we're going to wake up and we're going to do whatever it is that it takes to be happy.